Hi, Assalamualaikum warahmatullahi wabarakatuh. My name is Nurshana binti Romain. My ID number is Bosch 20021750. I'm going to present about medical surveillance program at the workplace. Purpose of a medical surveillance. Medical surveillance as a preventive and remedial measures. Medical surveillance also provide medical examinations and clinical tests on workers. Silica regulation. Silica regulation notice of proposed rulemaking issues in 2013. Rule targeted to general industry as a manufacturing and construction. Silica regulation also contain a more protective permissible exposure limit, which is PL. Silica regulation. Silica regulations notice of proposed rulemaking issues in 2013. Silica regulations rule targeted to general industry such as manufacturing and construction. Silica regulations contain a more protective permissible exposure limit. Permissible exposure limit (PEL). PEL is a maximum amount or a concentration of a chemical or physical agent a worker may be exposed to under OSHA regulation. PEL is set at 50 micrograms per cubic meter of air and 8 hours TWA. Okay, next slide is exposure assessment. A contractor is required to assess the exposure of any workers who is exposed or may be reasonable be exposed to silica at or above the actual level of 25 micrograms per cubic meter of air. This can be accomplished by air monitoring by using personal sampling method.
Good evening, madam. My name is Mohammed Sufian Shah bin Samsul, and today I will continue about the pre-placement medical examination. Before the worker is assessed to be fit or not to work at the working site, they should perform X-rays and pulmonary function tests, which will examine the capacity of their lungs, either they are fit or not to work, and then the medical examination should be done periodically, and then the frequency of examination depends on the intensity and length of exposure to silica, and depends on the worker's exposure. It should be done at least once every 2 years. And as for the medical examination, the certified health doctor will ask questions and inquiries about the worker's previous exposure to silica. Like the doctor gonna ask how long that the person has been working at that site, so that he could know the amount of exposure to silica that the patient has dealt with. And then they're gonna ask about their personal habits such as smoking, because we all know that smoking leads to cancer, with our respiratory disease, and present or past respiratory disorder, particularly tuberculosis. And then the information on the frequency and duration of exposure to silica since the previous examination. And then the health doctor will check the occurrence of signs and symptoms of respiratory disease such as dyspnea, cough, sputum, wheezing, and chest pain. And as for the physical examination, the general physical examination directed to the respiratory system. And then the frequency depends on the intensity and length of exposure. The physical examination that the doctor will conduct will depend on the frequency, on the intensity and length of exposure to the worker. And then depends to the exposure of worker. It shall be done not less than once every 2 years. And then as for clinical tests, X-ray and pulmonary function tests, which will target the lung, because from there we want to get the result, either the workers have some disease or not. And then examining physicians should obtain the medical status from another facility if the worker has been previously examined in the past year. And then as for pulmonary function tests, it should be taken in conjunction with the chest X-rays, which is they should do it simultaneously. And then the test should include the FEV1, which is forced expiratory volume in 1 second, and then result of FVC, forced vital capacity, and all relevant data should be corrected to body temperature and pressure. As you can see here, madam, at the left side, it is the graph for the obstructive and restrictive lung disorder. Obstructive is a condition that make our lung hard to exhale, and restrictive is difficulty to fully expanding your lungs with air. And then as for the result, you can see on the right side, there is 0 at risk, mild, moderate, severe, and very severe. So as for mild, the FEV is more than 80%, which is it is still on the normal state of lung functioning. And then moderate is below 80, severe is below 50, and very severe is 30%, which is the worst condition for our lung capacity. And then the last part is action levels. Assessment of workers' fitness for work based on clinical examination and clinical test results. Physicians will determine whether the worker is fit with limitation, or unfit for further exposure. This describes that the doctor will determine whether the worker can work again or not, or is fit to work based on the result of his lung function test. So that's all from us. Thank you, madam.